We're going to make a joke about that. This is awesome. Well, hey, everybody. Happy Wednesday. Happy day before Thanksgiving Wednesday. It is, I just can't believe it's this time of year again. Every year it's like, can you believe it? Can you believe it? And it just rolls around so fast, doesn't it? Oh my goodness. Well, I'm Kim Martin, host of Healthy You, and our goal is to just do a live podcast right here at Peoria Life every Wednesday morning and share information with you to help you make good choices, to give you education, information, hopefully a little motivation and encouragement to make it a little bit easier to live a healthy lifestyle. And there are so many pieces of the puzzle in living a healthy lifestyle. And the more of those pieces of the puzzle that we have working and we have, the prettier the picture is going to be. And so I am really excited. Officially, Dr. Christy Durbin of Synergy Healthcare and Sports Complex, you are going to be a monthly host with me.
Right.
One of our monthly experts on the fourth Wednesday of every month.
Right.
And so we're excited about that. We're going to learn so much. It's going to be awesome. And I know we were teasing what we were laughing about when you joined in was Jill Briney, but we were calling her Bob Barker. She's like, come on down with her microphone over there. So, and you're the patient educator, Jill. You go out in the community and help spread the good news of what you guys are doing over there, right?
Yes.
That's awesome. And so we started talking about stem cell therapy last month,
right?
Which you're gonna have to put me on payroll because like that's all I'm talking about. I want commission.
Great, that's great. Well,
I tell everybody about that. It's just an amazing product.
It is amazing. I mean, if you have someone who has a lot of joint pain because they're maybe a little older and have a lot of arthritis and degeneration in that joint. Maybe they've been told they're bone on bone, their only option surgery. The stem cell is an option. So instead of having surgery, they can use the stem cell therapy or regenerative therapy to help regrow that tissue that has been degenerated. So it stops the degeneration process and starts regenerating that joint. So it's been amazing and wonderful, but a step down from that to address the soft tissue is PRP, and that's platelet-rich plasma.
Okay.
So they're using that, and they've been using it for years and years and years, but no one really knows about it.
Okay.
And so we want to get it out, that information out to the public so they know there's other options instead of having surgery on, let's say, a tendon tear or a ligament tear. If it's a slight tear, you can actually inject in PRP, and that will help stimulate that healing response.
Really? Okay, so PRP.
It's platelet-rich plasma. So what happens, the procedure itself, is you actually have blood drawn from you.
Okay.
So like if you came in and you're like, oh yeah, I have this, slight bicipital tear, let's say. I was playing tennis and, whatever, you injured it. You would have it evaluated, of course. And if you're a candidate for it, then you actually have blood drawn. They use a special centrifuge that spins the blood and separates out the layers. And then the doctor, nurse practitioner, physician's assistant, whoever, medical staff, then draws that platelet-rich plasma into a syringe, and they inject that into the injured area.
So it's your own blood.
It's your own blood. It's your own it's your own healing process, but it concentrates that healing process by spinning it down and getting all those platelets. It concentrates it up to 5 times normal concentration, and you're injecting it right into the injury site.
That is so cool.
So there's like growth factors and cytokines that are also in your blood.
Mm-hmm.
And when you inject that in, it's like, oh, there's an injury here. Let's hurry up and start the repair process. And that happens on a daily basis anyway. When you cut yourself, you have that same response. It's an injury response. Your cytokines go, hey, get these platelets over here. We need some help.
And your little soldiers.
Exactly.
Those little soldiers go to work.
Exactly. So that same process happens in your body anyway. But by drawing the blood and concentrating those platelets, you're getting 5 times the healing power right where you need it.
I love science.
I do too.
So because of that, I'm like, that is so
It's so
cool.
cool.
It's
Yeah.
like so cool. But hey, guys, are you listening to this? This is amazing. If you know someone who is in pain, if you are in pain, if you have been told that you need some type of joint replacement, or if you have a tear, you got to check this out. Make sure you share this show. Show us some love. That's always awesome.
Yeah.
And you can post comments. We can't see the comments right now, but post those comments, and either Jill or Dr. Christy will come back and answer those for you later, because I know you're going to have a lot of questions about this. This is amazing, because what you're talking about and what I hear is not a Band-Aid.
No.
You're fixing the problem.
Right. The problem's actually fixed by your body's own natural healing response. But what would take maybe 8 weeks or 12 weeks gets shortened down to a real short period of time. So athletes, professional athletes, and we have high school athletes that even come in and use this. If they have a sprain or a strain, they want to get back in the game right now.
Sure.
If they're serious athletes, they don't want to take time off. Golfers, if they have a tendonitis, or if they have golfer's elbow or epicondylitis, they don't want to take that time to allow the body's natural healing process to occur. So what they do is get the PRP, speeds up that healing process so they can get right back into playing. So there's literally like very little to no downtime with this. It might not feel perfect right away, but because you're putting that PRP right where it needs it and you're stimulating that healing response, you're going to get back into the game much faster than what you would. Yeah. So Tiger Woods has used it for him. He's had injuries. He's used it. All the football players use it. All the professional athletes use it because they don't want to be sitting out. They don't get paid if they're sitting out, Well, maybe they do. I don't know.
They probably do, but trust me, I think they just want to play.
Yes, they do.
The money's nice. I'm sure they don't mind that.
Yeah.
But they really
don't want to take time off.
They want to play. They want to play.
Mm-hmm.
Okay, so here's the deal. You got this product. We're talking about stem cell therapy, and now you're talking about this other regenerative therapy that you can do. Why? My thought is, why isn't everyone lined up out the door? I can't believe you even have appointments. What do you run into, Jill, when you're out in the community and you're sharing this? What are so I'm sure the listeners are going, this is too good to be true.
Yeah, there's a lack of knowledge of it, and then it does sound so good to be true, but then when you're explaining it to someone and they're like, oh, I don't have to have surgery, or, these other options that I've been given that were the only options I thought I had, they're excited, and so we can get them in once they talk to Dr. Christy, then it really sets home for them.
Yeah,
so.
I know when they meet with you, because you're awesome at what you do. I know you know this, but stroke your ego a little.
Thank
you. No, you really are, and I'm sure once they talk to you, once you get them in and they meet with you, then they're going to be a lot more confident.
Open. More open to other things. I think most people just follow that typical pathway. Cortisone injection, okay, that didn't really work.
Right.
Physical therapy, okay, I'm still not healed up yet. I've rested it for 6 weeks. It's still hurting. They don't know what else to do. So then, they just follow that line of progression, and then surgery is usually the next step, or more time off. And people don't like to take time off. They want to have fun and do what they want to do. So this just is a different option for them. But people just don't know about it. I mean, that's just,
we got to spread the word.
They just don't know.
Because the thing about why is this so important in living a healthy lifestyle? Well, if you're in pain, that just cramps everything.
It does. Not only do you decrease your activities, but depression sets in because you're not doing what you love.
Right.
It completely disrupts your lifestyle if you're injured. You start to actually produce cortisol, which is a bad hormone that you don't want to produce all the time. Sleep patterns are interrupted with pain. It just throws your whole life into a mess.
And you're taking medications, these synthetic medications that have all these other side effects.
Right. Which
constantly in and out of the doctors, having to get the cortisone shots, and those things have side effects.
They do. And speaking of that, there's no side effects to PRP because it's just you're really just drawing your own blood, spinning it down, injecting it back in. So there's no adverse reactions. There's no side effects to it at all. You're using your body's own natural healing ability. You're just
You're like kickstarting.
You're just
advancing it
kickstarting,
because
and
you're
you're
putting
just
it right where it needs to go.
and concentrating it.
That reminds me, it makes sense, perfect sense to me. I understand science and how that works. But another therapy that I had heard of that sometimes, for whatever reason, and maybe you can touch on this too, Dr. Christy, when we have an injury, your body just doesn't want to get there and heal it. So there are some people, like one of my members had a terrible hip injury. And really, it was like a torn muscle or, a sprained muscle or something like that. But her body would not heal it. And so they went in and literally dug in there. I don't know what it's called, but they dug in there so deep they basically re-injured the injury.
To create the injury again.
To create what you're talking about.
To stimulate the healing response.
Yeah.
Yep.
So
they tried to start that response over.
And this would work for an old injury as well. So if someone like that came into our office, this would be a little less invasive, it sounds like, but it would start the same process and actually, like Dr. Christy said, be 5 times kind of more concentrated and stronger.
Why is it that old injuries? What do you understand what happens in your body and why your body's like, we're just used to that? So
yeah, sure. Well, if you, let's say you play tennis, and you have some tendonitis, but you're the person who is never going to stop playing tennis, so you're constantly re-injuring that area. And so the cytokines are kind of like your foreman, and they're saying, hey, get over here and heal this tissue, but they keep coming up against this brick wall because you keep re-injuring the same thing. So finally they're like, okay, we're done. We're tired. We can't do it. This is how it's going to be. And so then you end up holding onto that injury or holding that inflammation in the area. Your body, they just kind of shut down and say, our job is done because you can't, you're fighting against us.
You're fighting against yourself, basically. Yes. And so then your body just stops doing that. Well, I think that's where homeostasis comes in. Homeostasis is such a cool thing because your body starts to do whatever it's used to, right? So it starts to operate under what its new normal is. And so if you have an injury that you keep re-injuring over and over because you aren't going to stop doing whatever it is that you're doing, your homeostasis goes, okay, this is our new normal. So how do we work as efficient as we can with this normal injury?
With this new thing. Right, exactly. So with the PRP, the injection itself and taking those cytokines and concentrating it in the growth factors and the platelets and concentrating it into that area says, oh, it's a new injury. So it's no longer homeostasis. It's going to clear out that old inflammation and work really hard to heal that injury. Yep.
I hope if you're listening or watching this later, because you can, come back later and watch if you're getting busy and need to go. It'll be on Peoria Life on the website and on Facebook, and we'll post it all over our pages. But you got to understand this is healing. Your body is healing, and if it makes sense, that's how you're just working with your body to do what it's supposed to do anyway.
Right. Yeah. And so for soft tissue, like small tears in the musculature, in the tendonitis, ligament issues where you have ligament instability or tears in the ligament. If you have cartilage tears, small meniscus tears, labrum tears, those kinds of things respond so well to PRP. And we use this in young people because they are athletic and they're, doing all these sports and their bodies are just overused and sometimes they don't get good rest and they don't want to rest because they want to be out there playing. Right. And so we use it for young people. It's amazing. So we use PRP when there isn't a lot of degeneration in the joint, whereas stem cell is more for like the degeneration in the joint.
Okay.
This is for soft tissue. So whenever there's, they might be a young person with no other degeneration, it's just that they have tendon issue or ligament issue or cartilage issue.
We're going to have to get some success stories on this show.
Yes,
I'm thinking of one of my members, and I haven't asked permission, so I won't say, but I have a few members that have done the stem cell therapy and some other people that I know. because I can't stop talking about it. 'Cause
You
it's
love that.
I love it because here's my member who had a frozen shoulder, who could not raise her arm. She could not exercise. And she just had the therapy done in your office maybe a couple months ago.
Yeah.
And last month, when she came back into curve, she came in smiling. And I mean, she was swinging her arm around. Like, be careful. She's like, no, it's all healed. Look at this. And she's swinging it around.
She was swinging it around in our office, too.
Yeah.
That's so funny.
She was so excited, and I see that, and I want people to have that. Like, I say, if you have this option, there is no reason to be in pain.
Right. There really isn't.
Not. And if you're fearful, they don't have anything to lose to come talk to you.
No, not at all. And I mean, really, the whole procedure is just a blood draw and an injection. So it's not like this is something that you should be fearful of. It's easy.
It's not scary.
This is easy.
Yeah. If you've had your blood drawn before, it's no worse than
Look away, maybe, if you don't like needles.
That would probably be me. I'm like, but I mean, it's better than the pain,
Right.
I mean, for sure.
Yeah.
Right.
And so, this is a little different. It's not the same thing as the stem cell therapy.
It's like a step down.
Okay.
But the stem cells really address the joint and degeneration. So it's more typically it's for an older person or someone who had a really bad injury when they were younger, but that joint has degenerated. So the bone has actually changed, the cartilage has thinned. So it's really for that degenerative process. PRP, anyone can have it. Like it's for anyone. So sprained ankles, sprained strains, tendinitis.
So they just heal a lot quicker.
It's so much faster.
Sometimes we use it in conjunction with stem cell, depending on
if they have soft
a lot
tissue
of tears and stuff.
Yeah. That's just, it just really is cool. So you guys got a lot going on.
We do.
Because Synergy Healthcare, but you also now have the sports complex out there.
Right.
And I know my daughter is in the volleyball club, and so there's kids out there all the time.
It's awesome.
Yeah. So just touch on that just a little bit.
Well, we also have just added 360 Speed and Performance.
Yes.
Which is
about that.
which is super exciting. We put up a new building for them, and they do more of the athletic training and more of the sports specific training. But they get you in a group. They're doing group sessions. They're doing individual training sessions, and it's really to take your athletic ability to that next level. Those workouts are hard. I mean,
but it keeps them in, but you know what it does too is it keeps them in shape. So then your injury is a lot less likely.
Right.
If you're fit, you're going to be less likely to injure yourself.
Not only that, but they're actually watching you do the exercises, making sure you're doing it properly so that you're not going to injure, and they're strengthening so you're less likely to injure. But if you have an injury, they're sending them over to get the PRP done, and then they're back at it, so fast. It's just unbelievable.
That is unbelievable.
It's super cool.
Now, do you guys just do basic? I know because you have a physician assistant on staff and a nurse practitioner on staff. Are you doing any other kinds of, medical, like just for any basic sickness or, if I had a cold and I could call and be like, can I come see the nurse practitioner or something? I mean, do you do that too?
We do. We do. And we do school physicals and sports physicals and just your regular doctor's visits. We do that as well. But something that we just learned at the seminar that we were just at.
This is exciting.
This is using the PRP, which I just think is so cool. But they're actually using it for hair restoration. So male pattern baldness.
Really?
2 treatments. The results are unbelievable.
So this is for people that like their hair follicles are dead.
Oh, my husband's been bald since he was like 20. Yeah. No joke.
So like people that have tried like maybe some of the shampoos and stuff and they're not working for them, that's because their follicles are dead. And so
dead or dormant is the other terminology that they use. Like they're dormant, so they're no longer producing.
But this will stimulate that.
This stimulates those dormant.
Well, that's probably what they've been doing on that commercial on TV. They're like, this is really my hair. And you're like, yeah, right.
It really probably is.
They're probably doing this regenerative because they do use that word in that commercial. I'm sure everybody knows the commercial I'm talking about. You see it you still see it on TV.
So I went to a seminar this past weekend in Canton, Georgia, and they were talking about, take the blood, you do the spin it down, same thing, same procedure, but you're injecting into the head, and it stimulates those follicles to start producing hair again. After, I think it's 6 weeks, you start to see some result. But the pictures, the before and after, because I was like, whatever, but the before and after pictures are unbelievable. So it'll work great for women who have thinning hair, or it'll work great for people who have like male pattern baldness.
Yeah.
I don't know if I want your husband coming in who's been completely bald since he's 20. Yeah. I don't think
he's got a sexy bald head. I love it. I would not want, I'm totally cool with it. I'm like, no, that's,
no.
We were bald when I married you. We'll just
not for
say
him.
that way. No,
Yes.
but for especially like, what about
women?
Women,
especially
and there's
women.
that one disease, like
alopecia.
Alopecia. Yeah. So if you are suffering as an alopecia patient, am I saying that right? Alopecia.
Yeah.
Are those patients good candidates for that?
So yeah.
It's worth a shot.
Yeah.
Now, are you still doing, I know with the stem cell therapy, you allow people to come in and you do a free consultation.
I am so willing to do that. Yeah. For any condition, someone can come in and talk to me and we can see. I mean, I want to help people.
You do. And you know what, though? And your staff, like, I know you guys, you're a business member of I've Decided, and we are so grateful for that. But I went out there to meet with you on that business note, but your staff is just, they were like, hi, and so welcoming.
Yeah,
and,
that's how we like it.
Yeah,
it's our family. I mean, we want everyone to feel like they're, just a big part of our family. So I am always willing to sit down and talk with someone about what's going on with them to see if, we might be able to help. I don't know. We might be able to help. We might not. But if I can't, maybe
likely.
I can refer you.
More than likely we can help
I feel
you.
like you have enough options out there that you guys have a great facility and can definitely help. And I know Jill is out. You're out and about in the community everywhere, Jill.
Yeah.
So
try to get out there.
Spread the word.
Spread the good word, right?
Yeah. And then, and now you're going to be here, and I'm excited because we're going to get. We'll be moving into the new studio soon, and so as you guys, I think even next month we might be in the new studio. That's the plan. So we'll have more room, and I think we're going to even do some samples of the hands-on. So you can show off some of the things that you do would be awesome. So I'm really excited about all the information we're going to be able to share with
I have to
everyone.
tell you one more thing.
Kim,
I have to tell you one more thing.
You are going to love this. Yeah.
So
Kim's going to be all about this.
The other thing that we learned this past weekend was how to use PRP for more aesthetic purposes. So vampire facials. I don't know if you've heard of that before, but
look at her face.
You actually no.
I liked your reaction though.
Candidate for this. I can see it already. You're judging my crust.
No, I'm not. I promise. But they are using it with a derma roller to stimulate collagen production in your skin.
Are you for real?
I'm for real. And acne scars, to get rid of the acne scars, they use it for acne, and they're using it for stretch marks. The results are fabulous.
It in your face.
No,
right?
we use a derma. It's a micro needling is what it's called. It's like little tiny, almost like acupuncture needles, but it's on a roller. You can use it that way. And it helps the PRP to actually get in your skin where you need it to go. And it helps to stimulate collagen production, fill in lines, get rid of age spots, get rid of wrinkles. Scars. Like, I'm really interested in it for like the deep acne scars.
Yeah, and
it helps to heal that area.
If someone has something right on their face,
they
want to take care of that. But you know what I was thinking when you were talking about regenerative and we were talking about stem cell, and you may not know this answer because this might be something that you aren't specialized in, like burn victims. Are they using the stem cell to help regrow skin?
There's a video out there that you see them actually spray it on with, like, it looks like an airbrush sprayer.
Yeah, it's like a gun.
It just starts to, it's amazing.
They spray it on like so there's no need to do a skin graft.
Oh gosh, those are supposedly
and
so
it
painful.
would then look like your own skin.
Or again, and all the scars too from those
Yeah.
people who have been burned.
Right. And that, when they do a skin graft, that tissue always looks different, like what you're saying.
Yeah.
And so they can actually spray on the stem cell. The stem cell latches onto the good skin that's there, starts to replicate it, and fills it in with your normal looking skin.
Yeah.
It's amazing.
If you don't think that's cool, like seriously, something is wrong.
Yeah, you need to YouTube that, right?
Yeah.
You need to watch that.
Because this is, to me, this is science. Like, this is like the new age. Like, we're going to get to, it tells me down the road, we're going to get to a point to where surgeries are going to be few and far between.
Yeah, I hope
And
so.
I hope so
yeah.
too, because there's just better ways.
Well, and there's
obviously.
always
So many risks.
And risk when you have surgery, and not, you know, when you need it, you need it,
Yeah,
for
right.
sure. But
Definitely.
when there's things that you can do to prevent from having to have the surgery, we
Wouldn't
don't
you
want
want to do that?
yeah, you don't want to. And then hopefully as we continue to push forward in this and all these results, and we start to reach out to our insurance companies and push to say, why would you cover $100,000 surgery, but you won't cover this inexpensive procedure that's actually going to be a permanent fix? So I bet we're in the mix of even getting, I mean, if I were an insurance company, I would
It's coming.
wouldn't want to cover that.
Yeah.
Yeah, it's got to
It's
be.
moving
It's
in
got
that
to be. It
direction.
has to be. There's no, their insurance companies would want to. It cost everybody less
Right.
money.
Right.
So
It's
that's
moving
gonna
in
be-
that direction.
But in the meantime, you do make it affordable for
Sure.
people.
We
And-
never turn anyone away who wants care for anything, not just the injections, but for any reason. If someone comes into our office and they want care and maybe they don't have the financial means to do it, we always make it work.
That's awesome.
We want to help people.
And I believe you. Don't you believe her? I really do. And that's why I'm so thankful to be working with you, because you are my people. Like, these are my people. Like, the people that I want to work with who are passionate and caring. And you really do. You do it for the love of people.
Right. We want people to be able to do their normal activities, to have a good life, to improve their way of living. I mean, that's what we want for everyone.
Yeah.
So
Me too.
Absolutely.
That's what I want. And so it's going to be awesome. And then, of course, you guys do general chiropractic care
Right.
too,
And
right?
then
Because
we
you
do-
are a chiropractor, so
Yeah.
you do adjustments and things like that.
And we have a lot of different weight loss programs too, which I
Okay.
know goes along with really a healthy lifestyle. Sometimes people have a hard time getting there because of their weight.
Right.
And so we have a lot of weight loss programs that we're offering too. And I think we'll be talking about that next time, because
Yay,
everybody
yes.
wants to kick off the new year
Yeah.
with a new body. So, or
and-
new goals.
Yeah, and just try, you got to get to a healthy weight. It's very important.
Mm-hmm.
And exercise is a piece of that, a small piece, but you got to learn about
Right.
nutrition and
Right.
how to eat well. And we talk about that all the time. So that'll be a great topic. It's going to be a good year, because
Yeah.
we're going to
Yeah.
dive into a lot of great topics. So really quick in this last minute, this new regenerative therapy that you're looking at is called PRP.
PRP.
And it's like a step down from the stem cell.
Right. It's more, it
Like in the
addresses
same family.
family, but addresses more of the
what
soft
about
tissue.
like carpal tunnel? So, because I've seen so many people get their hand,
There's all kinds of things we can do for that.
Really? Yeah. So before you make any decisions, here's the thing, and this is what I've been telling a lot of the ladies at Curbs. Why wouldn't you get an opinion?
Right.
If you can come and talk to Dr. Christy at Synergy Healthcare, why would you not, and get a second opinion and see what your options are?
Yeah.
That's what I think. At least make a decision based on knowledge, not based on fear, not based on money, not based on anything else. Make the decision for your health based on knowledge. So once you have it, then you can make that decision.
Then you can take the course that you feel like is the best for you.
Right.
Yes.
Because there are options. There are always options.
Right.
And you're out and about in the community, so they can come talk to you.
That's right.
Where are you gonna be next?
Well, this week since the holiday, I won't be anywhere this week,
Yeah.
but starting next week, we'll be at Wellmobile Stops, so you
they
can
can-
check out the Wellmobile
Awesome.
schedule, and more than likely I will be there.
Come see Jill and ask some questions too. All right. Well, that's the end of our show. It's over. Half hour. It goes really fast when you're talking about cool stuff.
Yeah.
All right, guys. Have a happy Thanksgiving. Enjoy the rest of your Wednesday, and we'll be back next week. Awesome. Yeah, that's amazing.